Hello, I'm Dr. Mark Finneran. The purpose of this video is to demonstrate for those of you who have low back pain how to get rid of that pain. Now, this is assuming that the pain that you have is not serious and doesn't require surgery. The program that I'm going to describe to you has been developed over the past several years as a result of my working with over 10,000 people who have injured their backs at work. The program's simple. It can be done at home. It doesn't require any special equipment, and it works. In order for you to understand the program, you need to understand a little bit about the makeup of your low back. Beginning with the spine, and just for your orientation, this is the front towards your tummy, this is the back, and these are the bumps that you can feel on your back. The low back is made up of 5 different bones that stack up on top of each other like building blocks. The purpose of the bones is to allow us to stand up straight, and they also provide protection for the spinal cord and the nerves as they come down from the brain. The bones are connected to each other in 2 different ways. The first way is by facet joints, and these are small joints in the back of the bones that allow the bones to move freely on top of each other. The second way is between the bigger parts of the bone, and these are called discs. And the discs act like shock absorbers. Beginning with the facet joints. As I said, these are small joints in the back that allow us to move freely. They're like shingles on a roof that overlap, and they allow us to bend forward, bend backward, and bend from side to side. Now, bones by themselves are not much use. Bones need muscles to move them. And in the low back, there's 96 different muscles. And I'll spend a lot of time talking about muscles and how to get these muscles to relax. This is a picture of the muscles of your back. You can see there's a lot of them. They run from your tailbone to your head bone, and they run up and down along the spine. Muscles, no matter where they are in the body, all respond to pain the same way. They get tight. For example, if I reach out and touch a hot stove, I pull my arm back, and all of the muscles in my arm get tight, even though it was my fingertips that got burned. The back muscles are the same way. Regardless of where the pain came from, whether it's a disc or a joint or a ligament or a tendon, the response is the same. The muscles get tight. Well, that's where the similarities end. The muscles in our arms are different than the muscles in our back. The muscles in our arms are called fast twitch, fatigable muscles. That means they can move fast, but they get tired. For example, I can move my hand back and forth very rapidly, but it gets tired fairly soon. The muscles in our back are called slow twitch, non-fatigable muscles. That means the back muscles move slowly, but they don't get tired. So when back muscles get tight in response to pain, they stay tight and they don't get tired. Here's a simple example. If you make a fist and flex your muscle as tight as you can't hold it there very long. Pretty soon your muscle's going to get sore, your arm's going to get tired. You can make the pain go away by stretching your arm out. The problem with back muscles, in addition to the fact that they don't get tired, is that they're automatic. From the time we're toddlers and we learn to walk, our ability to stand upright is almost an instinct, kind of like breathing. That means that because our brains don't have a lot of control over our standing upright, we have a real hard time telling our back muscles to relax. There are 3 types of back pain. The first is muscular pain. The second is facet joint referred pain. And the third is radicular pain from a herniated disc. The first type of pain, muscular pain, is the most common. It's located in the low back above the belt line. And this is what most people have. The second type of pain is facet joint referred pain. This is pain that comes from the facet joints because they're inflamed. This type of pain goes through the buttock, down the thigh, and stops at about the level of the knee. This type of pain responds real well to over-the-counter anti-inflammatory medicines like Motrin or Nuprin or Advil. The third type of pain, radicular pain, comes from herniated discs. This type of pain shoots from your low back down your leg to your toes. It feels like you've hit your funny bone. If you've had this kind of pain, you need to see your doctor. Now that we've gotten through the tough part, let's talk about how you get rid of your back pain. I've already mentioned the fact that you can use ibuprofen as an anti-inflammatory medicine, and if you need it and your doctor says it's okay, that's fine. The rest of the program involves warming up and stretching out. You may have seen athletes before they play a game. The athletes will warm up and stretch out, and I want you to do the same thing. Let's talk about the warm-up part first. Before you stretch out your muscles, the muscles have to be warmed up. The easiest way to do this is to take a hot shower, or take a hot bath, or use a heating pad. Whatever method you choose, the muscles have to be warmed up for about 20 minutes. Sometimes doctors recommend that you use ice after you have a new injury to your low back, and that's fine for the first day or two. But if you think about it, if you were to go outside in the winter with just your bathing suit on, your muscles would get tight and you'd begin to shiver. We know that tight muscles in the back are the problem with ongoing low back pain, and since ice makes the back muscles tight, it's better to use heat before you begin to stretch the muscles. After the muscles are warmed up, it's time to stretch them out. The first thing you need to do is lie on the floor. Mark's going to help me demonstrate these stretches for you. And the first thing that I want you to see is as he lies flat with his legs straight, he has a curve under the small of his back. But when he bends his knees, that curve goes away. So as you lie flat on the floor, your knees need to be bent. The first two stretches are very similar. To do these, you start with your left leg, intertwine your fingers, and wrap them around your knee. It's important to always keep breathing as you do all of these stretches, and remember, these are gentle stretches. From this position, slowly pull your knee up towards your chest and hold it for a count of 5. And then straighten your arms back out. You'll repeat this 10 times. Then you go to your right knee. With your fingers intertwined, wrapped around your knee, you'll slowly pull your knee up towards your chest and hold it for a count of 5. And then straighten your arms back out to a neutral position. You'll repeat it 10 times on the right leg. The third stretch I found most people have a very difficult time getting. Mark's going to demonstrate the wrong way to do it and then the right way to do it. It's called a pelvic tilt, and people confuse it with a pelvic thrust. Mark's going to demonstrate a pelvic thrust. This is not what I want you to do. The purpose of a pelvic tilt in all of these stretches is to stretch the back muscles. To do a pelvic tilt properly, you roll the pelvis up and hold it for a count of 5. As you do this, you'll know you're doing it right when you feel a pulling sensation in the middle of your low back at the top of your buttocks. You'll roll your pelvis back down, and I'm going to have him repeat that one more time so you see it. You roll the pelvis up, hold it for a count of 5, and then lower back down. With these 3 stretches, we've stretched the muscles about up to the middle of the back. If you remember from the pictures, the muscles go from the tailbone all the way up to the head. So it's important to stretch the top half as well. And I found that if people don't do this fourth one, they get headaches. The fourth stretch is called a crunch stretch. It looks like a sit-up, it sounds like a sit-up, but it's not. It's a stretch. To do it, you place your hands flat on the floor, you tuck your chin and start a sit-up, and as you do it, reach for your heels. As you reach, you'll feel a pulling sensation down the center of your spine to about the middle of your back. You'll hold that for a count of 5 and then roll back down. You'll repeat that stretch 10 times as well. And to review, left knee, pull it to your chest and hold it for a count of 5. Do that 10 times. Right knee to chest, hold for 5 seconds. Do that 10 times. Pelvic tilt, hold for 5 seconds. Do that 10 times. And finish up with the crunch stretch. Again, holding it for 5 seconds, doing it 10 times. This is the entire program. Anti-inflammatory medicine if you need it, and if your doctor recommends it. Warm up the muscles with heat for at least 20 minutes before you do the stretches. Do the 4 stretches that we've just demonstrated. Remember to keep breathing while you stretch. And finally, remember these are gentle stretches. I took care of a man once who thought if a little of these stretches were good, a lot would be better. He did these twice a day, 7 days a week, 45 minutes each time. It was a really dumb thing to do. It made his back pain a lot worse. Athletes, before they play a game, they warm up and they stretch out. Then they play the game. The stretch is not the game. Likewise, these back stretches are not the game. Life is the game. These stretches are to help you live the game of life more comfortably. I hope this video has been helpful to you.